Testing, testing. Can you hear me? Can you all hear me? Nice. Okay. Give it a couple more minutes. It is 11 o'clock. See if anyone else is going to. Okay. Good morning, everyone. Good morning. Okay. Thank you all for joining us today. We are starting our first, this is our first episode for the Health and Human Services Department, um, specifically the COVID response team, to kind of create an opportunity for not just us to provide an update on COVID response topics, but also on HHS activities. This is going to be a weekly event that we're going to do. We'll talk a little bit later on about what the time and date's going to be. But first, I want to introduce why we're doing this. So, the purpose of this is to increase communication with the community, specifically around everything health and human services and COVID um, during the pandemic, since we can't meet together. And I think I forgot one thing here. For those of you who don't know me, my name is Troy Campbell. I'm the Health and Human Services Director and team lead for the COVID response team for the Pueblo. And this is going to give an opportunity for the public to ask questions instead of kind of like we send out the bulletins every month, and there's information in there about COVID and health and human services, and then there's the blast that goes out in the evening to talk about COVID cases, and also the social media posts, but nobody really gets an opportunity to ask questions. And so, what this is going to do is provide that opportunity for the community to ask questions as we provide the information to the best of our ability, of course. We may not have any answers right away, but if we don't have the answers, we will get them for you. Um, so, kind of wanted to lay out a couple of rules. Yes, you will be able to ask questions in the comment section, but we want to try to avoid any kind of abusive language, profanity, inappropriate comments, things like that in the comment section, because we do want to make this a an opportunity for people to share things freely without any kind of intimidation or stigma, and give an open forum for anybody who wants to participate to actually participate. This is streaming live on both the Facebook page for Health and Human Services, as well as the Facebook group for Health and Human Services, and our YouTube page. So you can join each week um, to get the information that we're going to share um, on either one of those locations online. So I'd like to first of all introduce members of our team. We have some folks that are on with me right now that are going to be part of today's presentation. Um, we have our presenter today is going to be someone that some of you may not have met. It is a person that has been assigned to the Pueblo and now part of our COVID response team from the CDC Foundation, through our Aztec um, partners. But along with her is another one of our new additions to the team is LaDawn, and we also have Raylene on there. And I'm going to give each person an opportunity to introduce themselves so you can know who you're listening to and talking to and asking questions to today. So we'll start with Rebecca, because she will be our presenter for our COVID update, and she will be able to introduce herself and tell you who she is.
Thank you, Troy. I'm hoping you can hear me all right. Are you able to hear me? Okay. My name is Rebecca Jolin. I currently live in Rio Rancho, and I have been a registered nurse since 2016. I have experience working in the hospitals with progressive care and also working in the main OR at UNM. So far, I really like it here. I'm very excited and grateful to have this opportunity. I enjoy a lot of outdoor activities like horseback riding and rafting. My husband and I have been together for 17 years, and we have 4 rescue cats currently. So, Troy?
Sorry, Thelma was coming in. I couldn't see her, and now she's added to the stream as well. So Thelma's also on here. We'll go next to LaDawn to introduce herself.
Hello, everyone. My name is LaDawn Yazi. I come from the Navajo Reservation. I'd like to say hello to all my relatives. I'm really happy to be here in a community helping in this response. It's been some time since things have, well, we've come into this time, and I really would like to contribute the best that I can. And I really hope that we're able to provide information going forward. I would like to do the best that I can helping in this process, working with individuals here. I'm very happy to be here on the Pueblo. And yeah, if you have any questions, feel free to reach out. Thank you.
Thank you, LaDawn. And Raylene?
Good morning, everyone. My name is Raylene Martinez. I am the diabetes program assistant. I do a number of things here in the community. Right now, we are swamped with COVID work. And so I hope that many of the people that are commenting will share this, and hope that next week or in the weeks to come that our following will be even greater. So thank you all for joining us today, and stay safe.
Thank you, Raylene. Thelma, you're up next.
Hello, everybody. Thelma Gonzalez. Work with the CHR program here in San Ildefonso, Pueblo. It's hope to see a lot of you on here soon, and I hope to give you all the information that, or answer some of the questions that you all may have regarding COVID or other information that you may want to know. But it's great that we're starting this, and I hope to see you all soon. Thank you.
Thank you, Thelma. We have one additional team member, Claudia Lente. She's not on right now. She's actually taking care of some other things that we have going on. So that is currently who the panel is today, to provide the update for not just the COVID response efforts in the community, but also for HHS. So with that being said, I'm going to turn it over to Rebecca to provide our COVID update.
Thank you. So our COVID update, currently as of January 12th of 2020, our total active positive cases for San Ildefonso for Pueblo to San Ildefonso community is 40. We had 2 cases added on this morning. Then our total new positive cases between January 10th and January 16th this year, 2022, is 15. Our total positive cases since November of 2020 has been 148, and our total recovered cases, people who've recovered from the illness, as of January 12th of this year, is 106. Now we are looking at rising cases currently. Nearly 7,000 new cases in New Mexico on January 11th, which is about 1 out of every 4 tests on average is positive in the state of New Mexico. Hospitals are definitely reaching critical limits, and we're looking at the crisis standards of care for folks who are requiring hospitalization. We do have variants, a mixture of variants currently. Omicron makes up about 60% of the cases in the state, whereas Delta is still about 40%. And you know, it's spreading rapidly. It's important to note that when they run COVID tests for PCR, and the state screens a percentage of those positive PCR tests to find out which variant is current. And so right now it's difficult to tell exactly what we might be seeing, but it is an overwhelming majority of tests that we think are Omicron. So in either way, we want to act with an abundance of caution and remember to do things like wash your hands and wear your masks when you're around other people inside, and also when you're around other people outside if you're within 6 feet and are doing activities especially. So essentially, we're looking at about a week or so before Omicron is certainly the dominant variant in the state. I also want to talk a little bit about isolation and quarantine and what the differences are between the two. They both sort of sound ominous and troublesome, but quarantine is essentially when you know you've had contact with somebody who tested positive for COVID-19, and you need to quarantine yourself from other people to watch for symptoms and to make sure that you're not spreading the virus. Isolation is when you are sick with COVID-19, you've tested positive and you have symptoms. And it really means that you need to remove yourself from the immediate presence of others. If you have to isolate in your home, one of the some of the important things that need to be done are surfaces, doorknobs, bathrooms need to be disinfected regularly. If you have COVID-19 and you're isolating in your home, you should also wear a mask, especially in the common areas and when you have to be around other family members. We really want to try to limit the spread of this disease. So I think at this moment are we open to questions yet, Troy? I guess I could talk a little bit more about how we can obtain compliance in the community. Because this this virus is so insidious and so easily spread. It's really important that we, as a community, band together for a common good to help protect each other. So, one of something that I've learned from others is you have a responsibility to each other to to help protect from this virus. So if you see someone that you know who maybe isn't wearing a mask, or maybe could be doing things a little bit differently, you might make a gentle suggestion to them, or ask them, please wear a mask. When it comes to isolation and quarantine, it's really important that we stick to the guidelines. Currently, it's important that if you come in contact with someone who is tested positive for COVID-19 and you are not completely vaccinated, and you have symptoms, you definitely need to quarantine. Well, you need to get seen if you have symptoms. This is a very complicated process, and we're working on a flow sheet and guidance through the executive order in order to disseminate this information and make it easier for everyone to understand. So if you are exposed to somebody who has COVID-19 and you develop symptoms, you do need to contact your doctor. You'll need to go and get a test at Buffalo Thunder or some of the other places that are offering the testing. If you are in contact with someone who has COVID-19, is positive for COVID-19, you want to, and you don't have symptoms, you want to quarantine for 5 days and watch for symptoms. If after the 5th day you get tested, you still have no symptoms, then you can leave quarantine. And what you'll need to do is wear a mask, wear a tight-fitting mask, one that doesn't have a lot of gaps in it, so that you're not spreading contaminant everywhere. Troy, are you with us?
I am
Hi.
here. Can you hear me?
Hi. Yes, I could use a little bit of maybe back and forth.
Yeah. Sorry, when you take the person off the screen, their mic mutes or mic mutes. I was talking the whole time and you couldn't hear me, so my apologies. I do wanted to clarify a couple of things. The executive order currently states that quarantine and isolation times are equal. They're 10 days each. We are going to be potentially going to a test out option, but the executive order has not been updated. We're working on doing that. Hopefully have it by the end of this week to have it changed. Working on a test out option. So if you do test, or so if you do come into contact with someone who is positive, you'll be able to test after 5 days, not on the 5th day, after 5 days, to determine if you are positive, and that way you can potentially come out of quarantine. So, but I do want to emphasize that the executive order currently states that it is 10 days for isolation and 10 days for quarantine. And what that means is you're staying in your home the entire time. You're not, just because you get a negative test from someplace else, it doesn't mean that you automatically come out of quarantine, because the executive order trumps any kind of CDC guidelines or any other kind of guidelines that you may be following for work or for school or anything like that, because the safety of the community is what's most important. So we're following the current executive order as it is written, which means 10 days of isolation or 10 days of quarantine regardless, because we have had a couple of situations recently where a person tested negative after 5 days or within that 5-day period, and then on the 7th day, they tested positive. So that's why it's important for to ride out the entire 10 days, because if you don't, you run the risk of um, a delayed uh, positive result, and then you start potentially spreading the virus around. We did get a comment in the comment section from a community member that talks about you'll show up positive for 3 months, but that is very specifically referring to the PCR test. That is not the antigen test that we do, is like the rapid test that we do here in the office or someplace else. The rapid test actually measures the amount of virus that's either in your nasal passages or in your throat, which shows that you have an active infection in your body right now, and you are still technically contagious. So the PCR test will pick up virus particles in your system after the 10 days. So yes, if you go to BTR and get a PCR test after you're technically no longer contagious after the 10 days, you will potentially test positive. However, if you do, like we talk about, the antigen test, which is what we do here, like I said earlier, or any other rapid home test that you have, those will be more accurate about active infection, not necessarily that you had COVID or were exposed to COVID in the past. So I just wanted to clarify that.
Thank you.
So with that, we did want to give the community opportunities to make comments or ask questions if they have any, to make sure that some of these points that we were making are clear and are understood, so that when you receive a call from us or you receive a call from Aztec for contact tracing, if you've been either exposed to or tested positive for COVID, you'll be prepared to, to kind of already understand what's expected of you. Those we've noticed a lot of different. I don't want to say non-compliance or violations, but there are some people out there that are either being exposed or testing positive, and they're still basically l- going out and doing things like normal. Like there's no restrictions or anything like that. But just understand that the most recent outbreaks, a lot of them during contact tracing, are being traced back to gatherings. They're being traced back to places where people have uh, gathered together or met together, and someone either didn't know they were positive or didn't know they were exposed, but yet they were already shedding virus, as they call it. You're contagious 2 to 3 days before your symptoms even show in many cases. So um, that's the reason why the executive order is written the way it is. That's the reason why masking and social distancing and avoiding large gatherings is important. Because if you don't do that, these potentially, they call pre-symptomatic cases, are spreading COVID all around, and that's the thing that we're trying to avoid. So if you have not read the executive order, there's going to be, as soon as the new version of the executive order is drafted and presented for the community uh, to understand, we will be providing another live stream to kind of go over the important parts of the executive order so people understand what's in it, and that there are no questions about what you're expected to do and what you're restricted from doing in this really difficult time that we're living in. So I don't have any other questions in the comments, so I wanted to move on um, to opportunities to get vaccinated. And there's always a lot of conversation and a lot of questions about whether we should get vaccinated or not. But it is important to understand that vaccines are available, and if you're eligible, especially if you're a high risk person in the community, you do want to consider getting um, getting vaccinated. Um, so just really quickly, the Santa Fe County and the Department of Health have opened up a um, a week-long vaccination clinic at the Milwaukee Fire Department. It is scheduled. It was started on January 11th and it ends on January 16th, but it is scheduled from 10 a.m. to 6 p.m. They are offering Pfizer only. and that includes the pediatric cases, the 5 to 11. It includes the prime and second dose for the 12 and up, and it also includes those who need boosters who have gotten that got their second dose of their initial series more than 5 months ago. That's basically the definition of a booster dose, the current definition of booster dose. If you have not received your booster dose and your second shot of your original series, it has been 5 months or more, you might want to consider going and getting your booster. Um, Buffalo Thunder is going to be hosting an IHS vaccine clinic on January 19th from 9 a.m. to 11:15. It is by appointment only. The previous one I mentioned at Milwaukee Fire Station, it is they want you to make an appointment, but you can just walk up and get a vaccine. But the one at BTR on January 19th, which is in 6 days, is offering Pfizer and Moderna, 12 and up. The pediatric dose is 5 to 11 for Pfizer, or sorry, for both. Actually, 5 to 11 for Pfizer and 6 to 11 for Moderna. They're also offering the prime and second shots and the boosters, as we discussed earlier. IHS is still offering vaccinations at the Santa Fe Service Unit by appointment only, just like the IHS clinic at BTR is offering all the available shots, and you can make an appointment. 505-946-9203 is the appointment line. You can call that number and make an appointment for your vaccines at the Santa Fe Service Unit. Testing, we do offer testing, like we talked about before. We have a limited supply of tests. Limited, not like some other places who have very little. We actually just got a supply in, so we do offer the testing. It is the nasal swab. It is not the one that's the most comfortable, but it is available here at the clinic, and that is by appointment only. If you want to get tested here, if you've been exposed and you are not symptomatic, that's what's most important. We're not equipped here to handle a large quantity of individuals who are symptomatic, and the opportunity for exposure for others is high in a small place like we have. So we kind of want to prevent a large number of people who are symptomatic from coming inside the building. So if you are symptomatic or mildly symptomatic, so you just have a runny nose or something like that, you can call us up and make an appointment to come by and get tested. I don't know if you all have watched the news lately, but the Biden administration has been discussing making sure that all the insurance companies are offering free test kits for the members that are insured. And basically, it's supposed to start in a couple of days on January 15th, and you will be able to purchase home tests over the counter from most of your local pharmacies and request reimbursement from the pharmacies, from the insurance companies, and you can get up to 8 a month. And what basically that is, the boxes come with 2 kits inside, 2 test kits, and they'll give you 4 a month with 2 test kits in each. And the way it's designed is you take the test when you feel like you may have been exposed at that 5-day mark, and then you take another test 2 to 3 days later just to make sure that you didn't start developing that the virus didn't take hold in your system during that time frame. Buffalo Thunder is also still doing testing. However, they've changed their policy recently. I know some of you have gone down to Buffalo Thunder and got turned away recently. Yesterday, January 12th, they did change their criteria for testing. And the reason being is that they were getting people who were non-native, they were coming around through just showing up to get tested, and that basically is taking testing kits away from the tribal communities in the northern area. So they are now requiring, just like in the beginning of the pandemic, a referral to be sent by a member of the Covet response team the day before you're scheduled to get tested, so that they can they can get you in the system to get you tested. So you can no longer just show up. You actually have to have a referral from the COVID response team to be able to get in there and get tested. So their testing times are 9:30 a.m. to 11. They have been running over a little bit lately because of the numbers that are needing to be tested. But those are the times that they're testing. So if you wanted to go to BTR and get tested and it's 12 o'clock, you can still contact us to get the referral form sent over, but you won't be able to test until the next day. Um, IHS is also still providing tests at the Santa Fe Service Unit. It is by appointment only. The appointment line number that I gave earlier is the same number, the 505-946-9203. That number can get you not only appointments to get vaccinated and to get tested, but if you had any questions about COVID, they can also answer some questions there for you as well. To help to make things easier for the community also to contact us. I keep saying that, you have to contact us and make appointments. You have to call us to let us know you're coming over so you can let you inside the building. So I wanted to make sure, we have numbers. Yes, I can post the numbers. Sorry, I'll post that here in a second. There's a question in the comments. We have a new hotline number. It's a Covet hotline for our team. And what it's designed to do is to make one central contact point. Right now, we have advertised in the bulletin and we have advertised on the website all of our phone numbers and email addresses. But what happens is it gets kind of confusing sometimes with all the information coming to different people. So we kind of wanted to give the community one central number to contact us. And I'll post that in the comments here in a second. But the phone number, actually, I'll post it right now. The phone number is 505-252-5986. That number will be available Monday through Friday, 8 to 5, basically office hours for just basic appointment scheduling and contacting. But our on-call person that's going to be handling situations on the weekend, that number will also be assigned for on-call as well. If you're coming over to the medical building for any reason, whether you're coming over for diabetes prevention services or CHR services, right now we're also asking that you contact us or contact one of these staff before coming over, because we don't want people just walking in. We've actually had some experiences where people who were symptomatic for COVID just came walking in the front door, which also obviously puts us and other community members at risk if we're not prepared for you to come in. So please call us at the number that I just posted in the comments, 505-252-5986. And we can definitely get you set up for whatever you need to get set up for. So as far as COVID is concerned, I'm going to answer the questions that are in the comment section at the end. I do want to provide the Health and Human Services updates as well, so that you all can know some of the upcoming activities that are going on in the community through our department. The first update is I know we all miss Martha. Martha and our Healthy Kids and Healthy Communities program. She's been gone for some time now. However, we have been able to locate and identify another candidate for the position, and they are from the community, and they will be starting on January 24th in the Healthy Kids, Healthy Communities program. And she did give me permission to give her name, and it is Victoria Martinez. She will be starting the Healthy Kids, Healthy Communities position. She will be taking the place of where Martha was, and we will she'll be part of probably the part of the first, or sorry, not this next week's presentation, but the week after, because she will start on that Monday, the 24th. Also, LaDon, our health educator, will be providing a live stream on healthy weight, which I kind of wanted to kind of change the mood a little bit because talking COVID all the time can be pretty negative. So um, uh, we will be starting doing different health education and health presentations through this same format. It's not always going to be COVID. It's going to be other things as well. We're going to be inviting guests from IHS and Aztec and other public health areas to kind of discuss topics so that we can give other people an opportunity to provide you information um, than more than just us. Sometimes you guys are probably sick of hearing our voices all the time. So we like to give you an opportunity for other people to provide information. So, but Ladon on January 19th at 1 p.m. there's going to be a live stream on same areas, Facebook and YouTube, on healthy weight. And so if you are able to, you can log in and discuss um, the topic of healthy weight in the same format here. You'll be able to ask questions, provide live commentary on what uh, LaDonna is going to be presenting on. So, but for as far as the updates are concerned, that's what we have to provide for updates. And now, when to provide an opportunity for some of these questions in the comments to be addressed by the entire team. So, give me just a second. Okay, so Council Rep Martinez asked if we could make sure that a copy of a hard copy of the executive order or the guidelines can be provided to members of the community, and we can definitely make sure that that happens. Because I do know, like you mentioned, not everybody has social media or access to the executive order online. I do. I would also like to have it posted in the buildings, the different tribal offices, tribal buildings, because that way when people come in, they can also see what it says there. But we will try to get that out to people. And I did see that that CDC guidelines for caring for someone with COVID at home actually talked about that yesterday. It's important that people understand that if you have a person at home that's tested positive for COVID, there are different approaches that you have to take. You can't just do things like you did before, because otherwise you um, will either get COVID and get sick, or you will get COVID and spread it to other people if you're not you don't have any symptoms. Because regardless of whether you have symptoms or not, you're still going to spread it potentially to other people. So um, I will try to get that information, put something put together. Actually, Rebecca is actually designing some some handouts that we're going to be posting. But we can also try to include that and not just the bulletin, but try to get it out to the community so they can have that as well. So we will address that. Um, yeah, there's a comment in the section about in the question section about you know vaccinations, and I just wanted to make sure that everybody understands we do not we are not mandating vaccines at this point for the community. That is something that some of the other tribal communities have done, but it isn't something that we can force people to do at this point. Of course, if it comes through executive order, that is something that is a discussion for a later time. But we are not mandating it, so there can't really be any consequences for people who are not getting vaccinated, except that they're either going to get sick or spread it to their family, and that should be consequence enough. But I know that some people are not looking at that as being that important, because they continue to do what they do, continue to gather, continue to not wear their masks around people who, even people that are vulnerable to the virus, more vulnerable than others. They're not doing that. So I think that it's unfortunate, especially as feast approaches and feast day is approaching, and the holidays have been going around, this rise in cases has basically stopped a lot of the activities that we could have potentially participated in. And like I said earlier, a lot of these cases are being linked back to um, to gatherings, people gathering and not taking the precautions they're supposed to. So that is unfortunately a problem for the community. So we need to do what we can as a community to try to address that. Um, there's a comment about the capacity at Buffalo Thunder. Um, we have been looking at alternatives for isolation and quarantine. That is in discussion right now. I do know that some are frustrated about um, not having a place to quarantine or isolate away from family, but that is something that as a smaller community, we are constantly trying to find solutions for. So it is being discussed, and I do know that other tribal communities have developed options. But I think a lot of what we have dealt with is we've been pretty safe for so long with regard to case numbers. They've been low for quite some time, and so I think a lot of people have kind of taken this whole process for granted, and we haven't we just need to try to find other options than BTR to be able to isolate and quarantine folks, because we are seeing entire families that are being infected. They're passing it from one person will get it, and then uh the entire household gets it. So we need to try to find other options, and we are working on that. um there's the comment in here about posting the appointment line. I will post that right now. This is for IHS appointment line. If you all have Raylene, Ladon, Rebecca, Thelma, if you have anything to add to what I'm saying, please jump right on in.
Yeah, I think um, I think something that we can also contribute is, creating a household checklist and sort of maybe like a procedure list. As Nicole said, that it's possible to care for people who have COVID in your family or in your home. Um, it's a matter of understanding what it takes to prevent the spread and have the tools um, and information that you need to do that. So, absolutely.
So I just want to share something, if that's okay. Some of the small things that we don't think about from a day-to-day basis when we're looking or around individuals is the small things is basically washing your hands. So I noticed in some areas of the community and then some areas of the city, we're not really cognizant of how we wash our hands. And so sometimes we'll just kind of overlook or not even think about what we've been in contact with physically. So our hands are usually the dirtiest, or, some of the products that we carry around, maybe our cell phones, maybe our keys, some of those things we've got to be aware of, that they can carry germs. But also, one of the topics that came up in discussion yesterday was the masks that we have. So making sure that your masks fit nice and snug on your face and then all the way around. So some of those things we've got to consider. If your mask is loose fitting, or if you have maybe a material handmade, a mask that you have, be aware that some of those precautions, we've got to think about, and they can really it can make a difference to maybe do a little bit of research or even ask the COVID response team, what can we do to be a little bit safe as we proceed in our day-to-day activities. So we have those tips available. We can provide you with that information if you have questions as well.
And it is important to understand the Omicron has a kind of exposed a lot. I mean, COVID in general has exposed a lot, but when Omicron came along, because it is so contagious, we are understanding that the the masks that we have been wearing um, during the pandemic, the homemade masks, the cloth masks, the single layer masks, they have not been good at all. I mean, they've actually been the one of the most recent studies are saying that, you know, if you wear a cloth mask, a single layer mask, homemade mask, they're only good if you're in the room with someone who's positive for 15 minutes. And after 15 minutes, you know, you're shedding virus all over the place, and you're basically exposing people to the virus. And I know that originally, the whole conversation about masks was that um, you're protecting others from you if you had COVID-19 from spreading it to other people. But if you think about it, if you have a mask on and the person in front of you has a mask on, that's almost like two layers of masks, right? You're actually you're shielding each other from the possibility of giving each other COVID. It is not the best. I actually had an image that I was going to share today on the screen, but I completely forgot to upload it so that we can show it. But the most effective masks are either the surgical mask at the first layer. If you have a surgical mask, that's the if you can't get an N95, that's the best thing to wear. And both people should be wearing one of those. But the best case scenario is if you have an N95, those are the best. They're saying that if two people are wearing um, if two people are wearing an N95 and one person's positive in the same room, you can technically be safe up to 25 hours in the same room with the person if both people have a tight fitting N95. Now, there are some people who have small faces, and sometimes the N95 gives a little bit of leakage, and so it's not as protective. And if you have a really scruffy beard, sometimes it actually makes spaces in between the mask. But overall, the majority of people, if two people have an N95 mask on, you're pretty well protected if you're in the same room, even if one of you um, have COVID. And again, that's continuous wearing of the mask. You can't um, if you're eating, you should go to a different room. You know, if you're taking your N95 off, you should go to a different room. Because even though the other person has an N95 on, is protected, it's still somewhat of a risk. And Council Rep Martinez posted, you know, that I did talk about this at the tribal council meeting last night about N95s that we have available for the community if you need them. Now, we don't have an unlimited supply, but we do have some. And if you are interested in getting an N95 mask, contact us. We do have some from, you know, early on in the pandemic, and we didn't really get a chance to hand them out as much. So we do have some. So if you are a family who either currently has COVID or has an exposure, or you just want to try to prevent COVID as much, or more than a regular standard mask, you can contact us, and as long as supplies last, we can get you an N95 mask. So again, the hotline number 505-252-5986. You can call that number at any time, except for right now because it's in the other room. And we can get back to you and try to get you some items. If you are in isolation and quarantine, and you have already had a contact tracing contact, some of these requests that you're making during those communications with either us or Aztec, you can mention the types of masks that you need. So just let us know. And Elena, thank you for saying that. We will. Are you saying a fact sheet in general, or fact sheet specific to the elderly that you'd like to pass out? I just wanted to clarify that question before we answer it. Just in general. Okay. So part of having Ladon and Rebecca here is that they are doing a lot of information education tasks, and the handouts that are going to provide that general information about COVID. They're being generated right now. In fact, we had one of the final versions of one of them done yesterday, basically talking about when to quarantine and when to isolate and what the requirements are. So we will be posting that sometime soon, and we'll probably include that in the bulletin as well, so people can have it. Um, I think that it's a very good point that's being made in some of the comments in the comment section about some of the individuals in the community that do not have social media or do not have internet access to these things. We do need to make that stuff available for them. Especially, I mean, even if they have internet access and social media, we all know how the internet signal is sometimes around here, and we can't really get on. So I think we need to provide different options. One of the reasons why we created this process of live streaming is some people um, don't they don't learn or grasp information just from written communication like the bulletin or even stuff on social media. They like to hear it being said and then be able to ask questions to clarify. Because COVID is not easy to understand. Sometimes we even get confused because, the CDC guidelines have changed. The FDA gives mixed messaging. We all know that, which is one of the reasons why we are very specifically um, looking at not referring to CDC guidelines as our way of functioning because it has not been clear. We want to make sure that people understand that the executive order trumps any guidelines that are being released by the public health community. So when the executive order says this is the isolation and quarantine time, that's the isolation and quarantine time, regardless of what CDC guidelines say. Because I think that the governor is looking at the best interests of the community as in general, and CDC is looking at data that is coming from all over the country. It's not taking into consideration the rural areas that like where we live. For example, if you look at Texas and New York and California, they're saying that 95% of their cases as of a month ago was Omicron. Well, New Mexico is not a well-traveled state. We have a lot of rural areas, so Omicron is not going to get here as fast as it got to the other states. It'll be slow building. But the CDC changed their guidelines because that is the dominant strain in the country, and it leaves out us rural areas that are not being as affected by certain things. So we need to function as a community based on what the community needs, not on the needs of the country, because the country has different needs than we do. Um, we need to make sure that our people are protected based on the data that we have, and the data, as we just mentioned earlier. Um, so on January 1st, DOH reported that there were only 4 Omicron cases identified in the entire state of New Mexico. Well, other states were saying that 95% of their cases was Omicron. So that kind of shows you that the information is not necessarily accurate for New Mexico. So we have to act based on Sinai. We're not acting based on anybody else. We're not acting based on the state of New Mexico. We're acting based on Sinai because we are responsible for us, not responsible for everybody else. So just in general, we need to make sure we're focusing on the needs of the community, and that's why the executive order has to be what you look to, not the CDC guidelines. You can do that for your work if it's outside the Pueblo. You can do it for your school if it's outside the Pueblo. But what happens in the Pueblo is what we are most focused on. So I just wanted to point that out. Um, uh, yeah, I did see that Uline does have masks. So we are still able to get masks. Um, for our supplies, the N95 masks. But so we are not really necessarily concerned about running out of stock right away, but are constantly looking for sources just in case our supplies start getting low. But Uline does have pretty good supply, and I wanted to make sure that the community understands two things. The the online purchasing of like home tests and N95 masks, you really have to be careful. Again, just like the beginning of the pandemic, there are a lot of companies, so-called companies, that are out there selling um, home tests that are fraudulent. It was all over the news actually last week of people that were selling so-called COVID tests, and they're fake. They're not even testing for anything. They're just some liquid in a little tube and some swabs, and these are not even real tests. It's the same thing for N95 masks. There are a lot of fake N95 masks out there. Just because it says N95, it doesn't mean it's an N95. It should have an OSHA uh, um, um, approved stamp on the side, or something that it shows that it's been approved by a federal agency, because some of these places, these masks that are coming from overseas in China and other countries, they don't live up to the standards that our regulating organizations hold them to. So they may not be as protective as the masks that we can get and provide to you. So be very careful about what you're buying online. Just because it's cheap doesn't mean that it's real. Um,
Yeah, and I'd like to add, so your masks that are approved by OSHA actually go through an institution that's known as the National Institute for Occupational Safety and Health. And the abbreviation for that is NIOSH, and that's NIOSH. And many times, I don't think the print is dark enough here, but most N95 masks, respirator masks, will have the N95 or KN95 rating on it. They should have the NIOSH letters printed on it as well. And that means that they've gone through rigorous testing for airflow and particulate flow. The 95 in N95 actually means that the mask filters out 95%. And what they also do is they measure in microns, which is like a really, really small measurement for particles and for aerosols and droplets. It can measure down to, I believe it's less than 1 micron in some cases. I don't have the exact number, but those ratings are really important because they're based on science, and they know exactly what can and cannot pass through these masks.
Yeah, and it's important. It's important. And one of the other things is, like you said earlier, it's not easy to read. Sometimes you have to look really close because they stamp it with a press on some of those masks and not with ink. So you actually have to look in the white paper or the white material of the mask to really see um, what it says. But I know everybody is um, not going to be able to look at that. But I do think that if it comes in a box, it should say it on the side of the box. So I thank you for that, Ashley. Uh, so we do have a partnership with Aztec, um, the Albuquerque area, Southwest um, Tech is what she put in there in her little post there. So I'm going to post it up there. So Ashley, did you want to put the website on there? Did you want to post that? Or we can put that up on the screen. We do have a partnership with them with regard to our COVID contact tracing, our when we need to have families contacted when they've been exposed or tested positive. You will potentially get some contacts from the team to do the contact tracing and kind of help you to navigate the process if you have been exposed or if you tested positive. So don't be surprised if it's not one of our team members that are calling you to talk about it. We do refer through our partnership information to their team to allow them to help us, because as you can probably imagine, we had 40 plus cases in a period of 5 days. With the six of us, it's not really easy for us to do contact tracing and communication with the entire list of individuals who tested positive. So we do honor and really value our partnership with Aztec, because they have helped us throughout the pandemic tremendously. So I really do appreciate that. We appreciate their help. And there's Ashley's post there, has the information about their Facebook and their website. If you have any, they have really detailed information sheets, information about what to do with everything COVID. Talks about the safety and efficacy of vaccines and testing. All those things you can get through information sheets that are already prepared by Aztec. So if you look on their Facebook page or on their website, aaihb.org, you can actually get some of that information. A lot of the stuff that we talked about today, they have it in like a really digestible form, so you can read it and really understand what it's all about. So, all right, it is 12 o'clock. We have been on for about an hour. We expected the first presentation to go long because of questions. But in the future, our we anticipate providing the update um, somewhere between 15 and 30 minutes. So we're not holding the team hostage, so to speak, on the live stream, and also so that we can get back to doing the work that the community expects us to do. So we're going to leave it open for another 5 minutes and give people an opportunity to ask any follow-up questions that might come along. But while we wait for questions, any member of the team like to add anything before we close?
This is Raylene. We do assist individuals that require vaccinations yet. So if they need assistance in scheduling through IHS, they can give us a call and we can gladly help them. We also try to find out of other vaccination clinics in the area. So I did refer a few people yesterday to the clinic at the Milwaukee station. So I hope if anybody can benefit from that vaccine clinic, I hope you all can make it out there. Thank you.
I'd also like to add, if I'm now your public health nurse here at San Ildefonso, and I'm happy to try to answer folks' questions. If you need to email me, I will also be having a phone number shortly. I am listed on the San I website under the COVID response team, I believe, but definitely on the Health and Human Services website. And if I can't answer your question, I'll definitely try to get you the best information that we have. But I just wanted to put that out there. Feel free to send me an email or ask someone, and I can help answer your questions about COVID and about other health concerns and related materials as well.
This is Raylene again. I just received a text message. I wanted to clarify that the tests that are being collected at Buffalo Thunder require to be sent off. So you will not get immediate results. And right now, because of the high cases in the state of New Mexico, we are looking at about 48 hours turnaround time to receive those results. Required to be.
To answer your question, Kitty, I do believe currently boosters are available from the ages of 12 to 17. I think it's, I do believe, correct me if I'm wrong, Troy, that it's Pfizer and Moderna. And then currently they've approved Pfizer only for the primary doses for 5 to 11. Is that correct?
So the boosters are available for 12 to 15 for Pfizer only. 16 and 17, I believe there's still consideration from Moderna around those boosters, but they are available for by in Pfizer only. So and the 5 to 11 is only Pfizer, but there's a 6 to 11 that's being considered for Moderna.
And do we have information on, because I know that 18 and over, you're allowed to mix the different vaccines for different things. Is it the same for the under 18 crew?
No, it's not. So the FDA and CDC have only approved boosters for 12 to 15 for Pfizer only. Moderna is still considering that. But I will say that mix and match is available for 18 and up, for Johnson and Johnson, Pfizer, and for Moderna. But understand that boosters are generally available for people who have gotten the Johnson and Johnson vaccine 2 months after you've gotten your vaccine. The other two are 5 months after you've gotten your vaccine, your second dose of your vaccine. So, and I did want to clarify, the CDC has come out in support of boosters from Pfizer and Moderna. They are not necessarily saying you shouldn't get a Johnson and Johnson booster, but because of how long they last in your system, they're recommending a Moderna or a Pfizer booster if you're eligible for one. Anyone else? Thelma, do you have anything?
Just want to say is that I just, everyone to please, take care of yourself, and just watch yourself out there. Try to limit your outgoing. And I just want to thank everybody for, being on and being able to get on and make comments. We really do appreciate it. And, we're doing the best we can. And thank you very much for getting on. I really appreciate it.
LaDawn, you have any last words?
No, just thank you for everyone coming together, and then also just participating in the comments and providing us with information, but also providing us with allowing us to answer those questions. Thank you.
Okay. Well, it's 12:07. We actually have some rapid test kits to go pick up at Buffalo Thunder because we have a new supply coming in. So somebody's gonna have to rush down there. So thank you all again for joining us. This live stream will be posted. Obviously, when we're done, it'll actually shows where you can watch it again later if you missed the first part of it, or if you like to watch it again, it will be on there as a recording, both on the Facebook page, on the Facebook group, and on YouTube. So if there are no other questions, no other comments, I'd like to thank you all, and we are going to end our presentation. Oh, sorry. Next week, LaDawn will be providing our COVID update. And I think we're going to continue with it being on Thursday. Initially, we thought about Wednesday, but because Rebecca is not in the office here in person on Wednesday, we're going to do it on Thursday because that means the entire team is here, just in case questions need to be asked of them specifically. Yes, she can Zoom in from home, but we kind of prefer her to be here in person to provide the information. So next week, Thursday, the 20th, at 11 o'clock will be our next live stream for COVID updates and Health and Human Services updates. But don't forget, LaDawn will be be providing her Healthy Weight live stream on January 19th at 1 o'clock. So tune in for that. So again, thank you to the community. Thank you to governor and administration for allowing us to do this. And we will see you next week.